breastfeed boys because they breastfeed more, so they must eat for them to be strong. If we can have one person just unmute and share any breastfeeding myth that you have had. Maybe, Carol, you can select one person from the participants.
Okay, shortly.
All right.
Agnes Thante, one of our participants. Are you able to share any myth that you know about breastfeeding?
Any myth, anything that is said. I know there's a lot that has been said in villages, where in our social circles, in our chamas, there's a lot that is being said about breastfeeding. So what have you had?
I have not. Let me welcome another, Joseph Nganga Wanyuike.
Hello.
Yes, hi, we can hear you.
Yeah, I have not had much because when I was breastfeeding, I did not find any difference between a boy and a girl.
All right.
Yeah,
okay.
But I know some refuse to breastfeed, so I don't know why they refuse.
Okay.
Yeah.
Yeah, some people believe that some children refuse to breastfeed, and you find that some children actually stop breastfeeding early. And if you ask the mother or the parent, they would tell you that, this one refused to breastfeed, or this one doesn't like breast milk. So that is just one of those myths. A lot of people believe in our society some things about breastfeeding. Most of them may be true, and a majority of them, again, may not be true. So we're going to look at those things. Those myths are the ones that influence our decisions as women or as parents also, because men also, as fathers, you have a significant role to play in your wife's breastfeeding journey or in your child's breastfeeding journey. So we're going to look at some of these challenges and how best can you take part in alleviating these challenges, or making sure that despite the challenges, your wife, your sister, your mother, whoever it is you're working with, or your colleague, whoever it is, is able to successfully achieve exclusive breastfeeding, and of course proceed with breastfeeding up to the recommended age, which is at least 2 years. So we'll start off by looking at what are the benefits of breastfeeding. Why is it important, or why is it good to breastfeed a child? There are benefits that will be experienced by the mother, and there are also benefits that will be experienced by the child. So looking at some of the benefits of breastfeeding, some of the benefits that the baby may get from exclusively breastfeeding, and of course continued breastfeeding thereafter, is one is that breast milk is easy to digest and to be absorbed in the baby's gut. So that means the baby will suffer less of digestive system issues. The baby will have less of the diarrheas, of constipation, less of discomfort after eating, and gassiness. So it's easy for the baby to be able to digest and absorb the food. And that means the baby is also able to absorb maximum nutrients. So the baby achieves the best nutritional benefit from the breast milk. Then breast milk contains antibodies that help to boost the baby's immune system. So it's not just about food, but also the baby achieves a boost on their immune system. The baby is also able to get maximum calories that help that help in the baby's growth and healthy weight gain, so that the baby is able to grow accordingly. And if you look at the recommended weight gain on the baby's chart, you find that the baby is within is within range. There are instances where you may even find babies going above range, where you find babies are overweight. But as long as the baby is on exclusive breastfeeding, then it is okay, because some babies may tend to gain weight faster, especially in the early months, but over time, the weight regulates. So it is very important to have the baby on exclusive breastfeeding, because at this point, whether the baby is within weight range or above weight range, that means the baby could be slightly overweight, then you're sure the baby is not being fed on unnecessary nutrients. Another benefit is that breast milk is rich in omega acids, and these omega acids are very good in brain development. They help to boost the brain development of the baby. And so you find that research actually has shown that children who are breastfed exclusively for the first 6 months and also continue to breastfeed adequately up to at least a minimum of 2 years, they have been proven to have higher IQs compared to babies who did not breastfeed or fed on alternative methods other than breast milk. Breast milk is also very important in boosting the babies. We have said IQ levels, and also in boosting the brain development, to complete the brain development of the baby. We also have benefits that are good for the baby. Besides that, breast milk is also easily accessible and easily available. That means at the point of feeding the baby, you do not need any preparation. You do not need to use any bottles. You do not need to warm anything. You don't need water. You don't need anything. At the point that the baby needs to feed, the food is accessible and ready to feed. Then another benefit is that breast milk also helps to protect babies from short-term and long-term illnesses, and that means we have reduced instances of illnesses, sicknesses such as asthma, diabetes, obesity, also respiratory tract infections. They have been proven to be very low amongst babies who are on exclusive breastfeeding. For babies who get such infections while on exclusive breastfeeding, their rates of recovery have also been shown to be higher or better, faster than babies who are on other modes of feeding. And as the baby breastfeeds, and while a baby is breastfeeding and they get an infection, say a respiratory tract infection, usually in the process of breastfeeding, and there is skin-to-skin contact with the mother's body is able to produce antibodies that will be released through the breast that will help in a resolution of the infection. So breastfeeding a baby even more when they are unwell or when they have an infection boosts or improves the recovery rate of the baby. Then we also have better bonding between the